So let me introduce today's speakers. Kurt Brunner is the VIST Coordinator at the William S. Middleton Memorial Veterans Hospital in Madison, Wisconsin. Amy Wurf is a low vision therapist at the Wisconsin Council of the Blind and Visually Impaired. She is a facilitator of a low vision support group for veterans in Rock County. Clarence Rumpel is a veteran with recent experience at the Blind Rehabilitation Center at the Edward J. Hines Veterans Hospital in Illinois. So I'm going to turn the microphone over to Kurt, who will speak first.
Good morning, everyone. My name is Kurt Brunner. I'm a social worker at the Madison VA Hospital. I've worked there for about 7.5 years. The first 5.5 years I worked at the VA with our newly returning veteran population, and about 2 years ago I took my current position. My current position is what's called a VIST Coordinator. VIST stands for Visual Impairment Service Team Coordinator. There are 152 VAs across the country that have VIST coordinators. A VIST coordinator can be a social worker like myself or a blind rehab specialist. We work with veterans who are considered legally blind, whether that's by their visual acuity, which is the distance they can see, their visual fields, or in some cases a combination of both. Today I'm going to talk to you about eligibility and benefits for all veterans in general, and some specific benefits for veterans who are legally blind. I'm by no means an expert on all the benefits. I will do my best to cover them and answer any questions you have at the end. So what is the basic eligibility for a veteran coming into the VA? A veteran must be part of one of the 5 branches of the military, which is the Navy, Army, Air Force, Marine Corps, and Coast Guard. If they served in active duty and were discharged under conditions other than dishonorable, they would be eligible for care. For veterans who have enlisted between September 7th, 1980 and entered active duty on October 16th of 1981, they must have served 24 continuous months or the full period to which they were called for active duty. So for some people that might be they served less than 2 years, but they may have served an active duty tour of, say, 9 months, and so they would be eligible for care. Veterans who are eligible for VA health care need to complete a VA form, what's called 1010E as an echo Z, which is an application for health care benefits, and I will show you that in a couple minutes. They also have to have their what's called DD Delta Delta 214, which is their military discharge paperwork. If they don't have that with them, that's something that the VA can sometimes look up and find for them. Once a veteran is eligible for VA health care, they will be set up with a primary care provider, which at our VA here in Madison is a doctor or nurse practitioner. Some VAs do have physician's assistants or PAs. All doctors and nurse practitioners are part of what's called a PACT team, or Patient Aligned Care Team, which includes a nurse case manager and a primary care social worker. Veterans are eligible for specialty care, things such as physical therapy, occupational therapy, medication, mental health, etc., any type of specialty care. There may be some copays for these services, and we'll also discuss that in a moment. Some other things that veterans are eligible that I get a lot of questions about are eye exams. All veterans are eligible for basic eye exams. And those veterans who are 10% service-connected or have a service-connected disability of 10% or more are eligible for prescription glasses. VA does have dental services. However, I will say the criteria is pretty strict. So veterans have to be service-connected at 100% or are unemployable and paid at the 100% rate due to service-connected conditions. Veterans also can have a service-connected issue related specifically to their dental. I don't see that too often, but some do. Or if a veteran is a prisoner of war, they're eligible for dental care. And that's most of the people that are covered under dental. If you happen to meet a new veteran who just returned home from active duty, within the first 180 days of returning home, they can get a one-time dental exam and follow-up. The next slide is the VA priority groups and co-payments at a glance. So this is how the VA organizes veterans in regards to what co-pays they may have. The VA places veterans in priority groups primarily based off of their income or, again, if they have a service-connected disability status. There are 4 basic co-pay categories, as you can see, which are inpatient care, outpatient care, medication, and extended care services. Co-pays for primary care visits are $15. And again, for those specialty care visits, it would be $50 per day of visits. And I want to emphasize per day of visits. So if a veteran comes to meet with you and they have a number of appointments on a number of different days, it'd be good for them to call the VA and see if they can get those all on the same day. Specifically for veterans who are legally blind, they qualify for what is called catastrophic disability. This is a designation at the VA that automatically places veterans in priority group 4, which means the veteran has no copays for inpatient care, outpatient care, or medications. As you can imagine, this is a pretty good benefit for veterans who have never been at the VA or maybe have a higher income and would have all those copays. Next, I'm going to talk about service connection and VA pensions. If a veteran feels that any of their physical or mental health conditions were caused by their time in the military, and that can be anything physical or mental health, internal or external body systems, head to toe, they can file what's called a service-connected or service connection disability claim. These claims are filed through the veteran's County Veteran Service Officer, or CVSO. We're lucky here in Wisconsin. All 72 counties have a County Veteran Service Officer, and I'll show you a link to how to find them here at the end of my part of the presentation. If a veteran is service-connected, they do receive a monthly tax-free amount of money from the government. This is run through the Veterans Benefits Administration, or VBA. Our regional office is in Milwaukee. If you're in northern Wisconsin, your regional office may be in Minneapolis. Veterans may also qualify for what's called a VA pension, and this again is some tax-free dollars. The main criteria for VA pension is that a veteran served during a wartime period. In other words, some veterans served during post-Vietnam or post-Korea. Those are not considered wartime periods. A veteran has to be 65 years or older, or have a disability that would make it impossible to have gainful employment, such as legal blindness. And they have to have income that's below the veteran pension limit. The veteran pension limit for this year is $12,868 for a single veteran and $16,851 for a veteran with one dependent. So as you can see, a VA pension is really for someone who has a pretty low income, and it can then again supplement their income to hopefully meet their basic needs. There's another part called aid in attendance. Aid in attendance is additional monies on top of a pension. And this is when a veteran is at a point where they may need additional care based on their disabilities. So a veteran would qualify if they have pretty significant legal blindness. In other words, they're at 5/200 in their worst eye, or their visual fields are 5 degrees or less. So pretty significant blindness to the point where they may need some additional help. I'm going to show you a couple of the websites that I talked about so you know where those are found. As you can see, there's a page here that has the links to them. They're not hyperlinked on here, so I'm going to go to those. But these are good for you to reference. As everybody knows, Google is an amazing place to go, so feel free to Google any of these titles that I put up here, and you'll be able to see them. So first I'm going to show you VA Copay at a Glance. I know that was one of my sites here, but it's a little bit clearer here, so you can definitely just print this off if you ever want to give this to a veteran, and it is very helpful for them to look at. The next one is how to locate your County Veteran Service Officer. Again, this is a link that you can find just by going to a Google search, but it lists all the counties alphabetically. You can just click on that and it gives the name and address of the County Veteran Service Officer. The next one that I have is what's called, again, the 10-10 EZ. And again, this is something that would be very helpful to give to a veteran if they have not enrolled in Madison VA care or any VA care. This is our basic way to get eligibility through the VA. It looks a little intimidating, but really it's only 2 pages to complete. The rest of it is a lot of instructions. And if you ever want to write down the number to our VA while I'm talking about this, the main number to our Madison VA is 608-256-1901. And if you have questions about eligibility, eligibility's number is 608-280-7038. So they can help if you have questions about completing this 1010 EZ form. The last link I'm going to send you to is a main link under the VA, as you can see here. And what this is our whole benefits book. It's about 100 and some pages long, but they have it broke up into different chapters here. And this is really helpful for anybody who wants to further look into benefits that we have through the VA. And again, you can always call the number that I gave you before and ask to speak with someone who can help you to navigate these areas. So without further ado, I'm going to pass this along to Amy Wurf, who's going to talk more about the VA Continuum of Care and blind rehab.
Okay. Hi, my name is Amy Wurf, and I'm a low vision therapist with the Wisconsin Council of the Blind and Visually Impaired. I have been doing low vision for about 20 years now. I spent 13 years down at the Hines Blind Rehabilitation Center outside of Chicago. I spent 6 years up here at the Madison VA, and I've been fortunate to be here at the council since January. I'm very happy to be here and still working with people with low vision. So the first thing I'd like to do is give a little bit of a background information for those who might be a little fuzzy or a little unfamiliar, and just good review for vision acuities. So legal blindness is defined as a level of vision of 2200 or less in the better seeing eye that has the best correction possible, and or a visual field of 20 degrees or less. Low vision is defined as best corrected visual acuity of 2070 or less in the better seeing eye that cannot be corrected by standard optical, medical, or surgical interventions. And then we talk about functional vision loss, and that can be experienced at even 2050, sometimes 2040, if a person finds their daily living activities are impacted by their vision loss. Then we look at that as a functional vision loss. Blind rehabilitation services have been offered by the VA for over 60 years. In 1948, the first inpatient blind rehabilitation center opened at Hines in Illinois, and it was designed to address the unique needs of traumatically blinded servicemen and women returning from World War II, and it's continued to grow and expand across the country since that time. In 2008, Congress allocated money for a continuum of care to provide early intervention for patients with vision loss from macular degeneration, glaucoma, and diabetic retinopathy. They also provide services for troops returning from active duty from the wars that we're in. There were 55 new clinics that opened in 2008, and Madison was fortunate to get one of those. The mission of the clinics and of blind rehabilitation is to increase the independence and quality of life for visually impaired veterans and reduce dependence on families and communities. So the VA Continuum of Care here in Wisconsin, at all VA hospitals, or most veterans hospitals where they have regular eye clinics, there should be a level of basic low vision care. They should be able to provide simple magnifiers or high-powered glasses to help someone. Once that veteran reaches a point where that's not helpful, then they can come to the intermediate low vision clinic, and the William S. Middleton Memorial Veterans Hospital in Madison has that. There's a low vision optometrist in Madison. There will be a low vision therapist there. They provide comprehensive eye exams and a visual skills assessment, training with low vision devices, and basic adaptive daily living activities. The advanced clinic is in Milwaukee at the Clement J. Zablocki VA Medical Center, Milwaukee. They have the low vision optometrist, the low vision therapist, and they also include an orientation and mobility specialist. And as you probably know, those are the people that teach the visually impaired how to travel with a cane and to travel safely. So they add that on for the advanced clinic. And then the next level in the continuum is the inpatient training at the Central Blind Rehab Center at Edward Hines Jr. Hospital in Hines, Illinois. This is where generally only the legally blind veterans attend the inpatient training at Hines, or those with a significant functional vision loss. They have a multidisciplinary team. They have intensive rehabilitation. The stay is around anywhere from 5 to 7 to 8 weeks. It depends on the needs of the patient. They have low vision, orientation and mobility, living skills, manual skills, and adaptive computer training. So they try to focus on a veteran's life from the time they wake up in the morning to the time they go to bed at night. So what are the goals? What are the things that they can learn? And Mr. Rumpel is going to give much more information about that for us in a little bit. The inpatient training, again, is a few weeks long. It's its own separate building on the Hines property. It's a central. The location is everyone stays in one building, wrapped around. They have a nurse on staff 24 hours a day. Patients have their own room with their own bathroom. All of the blinded veterans eat in the same dining hall, and they do a lot of social activities to bring the guys together and the women together, let them know that there's other veterans out there who are experiencing the vision loss, share that information, they help each other out, and that's really a big part of that, is that camaraderie that the people have together. The continuum of care also includes a blind rehabilitation outpatient specialist, or BROS. The outpatient specialist provides pre- and post-training and follow-up to inpatient blind rehabilitation. They can provide the orientation and mobility training, activities of daily living, low vision, and also some computer assistance. And this is all within the veteran's home. There are BROS scattered out throughout the country. There is not a BROS in Wisconsin, and there is a rural BROS in Illinois, which I'll speak about in a second. The next level also is a vision impairment services and outpatient rehabilitation programs, or a VISR program. This is a short-term inpatient stay, about 2 weeks. The closest we have here in Wisconsin for that is Michigan and Minnesota have the VISR programs. They provide the low vision, orientation and mobility, communication, activities of daily living, and computers. And again, they have several specialists there. It's an intensive 2-week program. The veteran has to be fairly independent in their skills. They can't need nursing care. They need to be able to take their own medications. And then sometimes also some of the traumatically brain injured veterans will be part of this program. And then, as I mentioned earlier, there is a rural BROS in Illinois, so an outpatient specialist in Illinois who can provide orientation and mobility and also low vision care. This person travels all throughout many of the counties in Illinois and has come up into Wisconsin a little bit for us, so that they're being very gracious letting us use their services for that. Over here at the Council, the Wisconsin Council of the Blind and Visually Impaired, we offer services to all visually impaired persons in Wisconsin, not just veterans, but we certainly include veterans if we can. We provide low vision evaluations here at our site and at our Williamson Street address, and the low vision evaluations are similar but very different than what the low vision optometrist can do, but it's looking at functional vision, lighting and color and contrast, taking a look at adaptive aids. We also do in-home assessment and training, so we have several teachers who can go into the home and take a look at safety and kitchen skills and lighting and simple magnification and all of those things people need to be able to do that their vision is impacting, and can provide that training in the home. The training in the home there is no charge for, and that's a very critical component. We have a Sharper Vision store here at our site, and that's a store with lots and lots of visual aids. We've got magnifiers, talking clocks and watches, talking scales, kitchen adaptive tools, games, all kinds of things. We have a mail order catalog available, but it's open every day of the week from 8 to 4:30, so anyone can stop in and purchase items. We also provide free white canes for legally blind people in Wisconsin. The services for veterans with the Wisconsin Council of the Blind and Visually Impaired, we can supplement what the VA here in Madison can offer. We can go a little farther than the VA in Madison can offer, but the veterans do have to pay for any equipment that they would purchase from the council. The very large benefit of being enrolled in the VA and getting your low vision services through the VA is that the VA will provide free of charge any adaptive equipment for the visually impaired. So closed circuit televisions are provided at no charge if the doctor recommends that. Magnifiers are provided at no charge if the doctor recommends that. And that's a really big difference, that the VA has that pot of money that they were able to set aside to provide those services for visually impaired and legally blind veterans. But we are very happy to work with any veteran here at the council and want to help out as much as we can. So I'm going to turn this over to Mr. Clarence Rumpel. He attended the Hines Blind Rehabilitation Center in January and February of 2015, and he's going to be able to give a good overview of his experience at the Blind Center.
Thank you, Amy, for the introduction. I did have a great opportunity of being eligible to attend the Blind Center in 2015, January and February. I express and emphasize the word opportunity because it really changes one's life in a very positive manner. Prior to going down there, I certainly would not say that I was, quote, depressed, but on the other hand, there's a tendency when you can't see or you have very limited vision, you begin to recognize that you can't do much of anything. That's an experience and a feeling that was dramatically changed by the professional group down at the Hines Center. What they do from a professional standpoint is to transfer your understanding that what you had in vision can be transferred to other senses such as touch and feel. And so much of that program involved the transfer of senses, again, from vision to touch, feel, etc. The program actually began with a week of, let's say, show and tell. Our opportunity was to express what we wanted to accomplish while we were down there. And during that time of 1 week and visiting with all the various areas of academic experience we were going to have the opportunity to receive, they really determined what we may need, what we may be capable of, and that was transferred then into a weekly schedule of various types of training. The training actually included such things as an hour a day on various visual replacement skills, such as what you could see without any assistance, various other vision tools, if you will, be they electronic, something that you could use like almost like a microscope, various tools, let's say vision skill tools, that they determined exactly where we could use these. For example, one thing that you hang around your neck if you're going to a store would be a small thing that would allow you to see the what is in an aisle of a store, of a hardware store, of a grocery store, because you can't read those things. But with this magnifying glass, you could put it up to the one eye that you had the best skill in or best vision in, and you could actually determine what was on that aisle. Now, you had to be relatively close, but at least within 20, 30 feet, you might be able to actually read that, because it was a vision instrument that you could increase the vision on it. The other thing was what they called a Ruby RX, a screen that was about 3 by 5 in size, electronic, digital. Had various screen background colors, blue, yellow, black, natural color, and an accentuated a bright contrast of white and black. With this, you were able to go into a store, for example, a grocery store. You want to purchase something, and you could actually go onto a top shelf or a lower shelf, reach up there where the contents was located, press a button, and actually freeze a picture of that product. Take it down to your eye, read it, expand it in size, so you were actually able to determine, was that something I wanted to purchase? Did it have the right ingredients that I'm interested in from a health standpoint, and make your selection? Something you just could not do. And then there were larger pieces of equipment along that line that were also eligible. And eventually what happened was I was taken on tours to various stores. So I went shopping with my Vision Navigator. And we went to department stores, we went to food stores, we went to Costco's and things along that line. The whole objective was to try using these things and build your skill on how well you could make them work for you. And what impresses one very quickly is you learn that you can do anything anybody else can do. You may not be able to do it as well, but the fact is you can do it. That builds your confidence in life and your confidence in independence. And I might add that one of the things they stressed was build your independence. Ask for help when you know you need it, but when you can do it on your own, be independent. It makes a whole lot of difference in your quality of life. As we went through I might also add the time that you have down there is very much regulated, or let's say restricted, to what your needs are and what they can accomplish with you over a specific period of time. I was originally scheduled for about 4 weeks. I ended up staying there for 2 months, and for me it accomplished many of my goals on how I wanted to use those skills, not only for myself, but in some speaking engagements which I had planned to use these various types of equipment that were provided. We also received an opportunity to do things which, let's say, create a normal style of life, if you will. We had ballroom dancing once a week for an hour. That was a lot of fun. It was also amazing what we could learn without being able to see what we were doing. You didn't see your feet. You just had to follow the person with you and listen to what the instructions were. The other thing we did was I had an opportunity for over a month to go to the University of Illinois Chicago branch, and I learned how to kayak. So I was able to get in, I was able to get out, I was able to turn it over, be in the water upside down, couldn't see where I was, get back up, get back into the kayak, and then not only being in the kayaks, then help somebody else get in that was taught to turn over, etc. Again, confidence building, you learned what you could do. Perhaps the most challenging outside experience I had, however, was downhill skiing. Took us on a one-day trip. We went up to a ski hill in the southern part of Wisconsin. The first day we spent mostly just learning how to navigate, how to turn the skis, how to turn, how to stop, things along that line. Then we moved to, let's say, going downhill skiing in a very shallow difference in height. And when we got that down fairly well, then we were taken up to the top. What amazed me was not being able to see, learning simply by color navigation and by balance. I was able to get from the top to the bottom, and I never fell. That to me was an amazing skill that was developed through good education, encouragement, and learning how to use the senses that you still have remaining in full capacity. So from that standpoint, it was a fantastic experience. We also went to a concert at the Chicago Symphony location. Fantastic experience to be able to listen. Couldn't see it, but it's amazing when you have had vision in the past, and you have the orchestra up there, and you have a conductor up there, you still see in your mind. It's an amazing experience. There were other times, other optional things. For example, we went a number of times to various American Legion headquarters, so to speak, or chapters. We were able to play games. We had some ballroom dancing. We had some visitations. Just a chance to visit with each other and visit with other people. At these locations, we not only had the veterans there, but we had their wives there, we had their children there. So it became almost what you might say a family experience. The other thing I should mention from a skill standpoint, the facility at Hines is approximately 1 mile in length. Now that's more than just the blind center. And it sits on a section of land which is 640 acres, so it's a huge place. Blindfolded, I had to learn over that two-month period to move down all of the corridors, and they're all not straight over that 1 mile. I had to move blindfolded from one end to the other and back without falling down. I learned to use a cane as my second best friend. My first is still my wife, but the second best friend was that cane. And you actually, one of the things we learned was, if you want to walk straight, do what you learned in the military. Stand up straight, keep those shoulders back and those head up. And it's amazing how you can learn to walk straight. And in using that cane to occasionally tap the side of a wall, but moving it from side to side as close to the floor as possible so that you can determine if there's any differences in height. The cane becomes an amazing navigation tool. You learn to use your ears where there are machines that are operating, like cool drinks and so forth. You can identify various locations as you walk down these aisles as to what was there. And that was part of the navigation skill, was learn what you hear, feel with your cane, listen for voices, what direction are they coming from, so that way you can tell if you have intersecting aisles, corridors, so forth. All of these things become navigation points, just like if you were using a compass in a way. So it's a broad-based experience. The objective is to build your confidence, build your independence, but at the same time, be sure to understand when you need help, ask for help, but don't abuse it. And from an overall standpoint, these are the things I wanted to share with you and encourage you. I'm a veteran of the Korean conflict. I lost a significant amount of hearing while I was in the military. It was compounded by a loss of vision in 2013, and that became a catastrophic event. And with a loss of vision and a loss of hearing, it was a challenge that initially for me was pretty tough. But the Blind Center changed my outlook on life. So I wanted to share that with you and encourage you to, if you have the opportunity, to attend, and encourage you on one other thing. This is an opportunity to improve your life, improve your lifestyle, allow you to do things you think you cannot do, but you can. I did wood skills. I actually did a lathe work. I have done woodworking in the past, and I actually created a bowl on a lathe with the outside dimensions being somewhere around 1/4 to 3/8 of an inch thick. That's not particularly easy, but I learned it by feel entirely. And so the skill opportunities are there. We also did other things like weaving. I made a woven belt and a holster for my cane, so to speak. So all of these were opportunities to build up that skill, to build up that confidence, and eventually what it amounted to is I left there as a changed person. So I share this with you, encourage you to take the opportunity when it's made available, and I know it will improve your life. God bless you.
Well, thank you, Mr. Rumpel. That was wonderful. And I'm so happy you had such a wonderful experience, and it really can be a very life-changing experience at the Blind Center or any of the Blind Centers around the country. If a veteran's able to get there, it's really quite an amazing place. So our final slide up here will kind of wrap things up a little bit and where to find assistance within Wisconsin in particular for veterans. So again, we have the first link for the County Veterans Service Officers, and that, if you need to write that down, it's http://wicso.org/locate-your-CVSO/. You can also, again, as Kurt mentioned, you can also just Google County Veteran Service Officers, Wisconsin, and you can find your way to that page. It's actually pretty simple, and then the page is broken down by county. The resource here in Madison is the William S. Middleton Veterans Hospital in Madison, and Kurt Brunner is the VIST Coordinator there. His contact number is 608-256-1901, extension 11960. At the Clement J. Zablocki VA Medical Center in Milwaukee, Leon Haith is the VIST Coordinator. His contact number is 414-384-2000, extension 41832. In Toma, at the VA Medical Center, the lady's name is Gina Hilmanowski. Her phone contact is 608-372-3971, extension 66440. And at the Oscar G. Johnson VA Medical Center in Iron Mountain, we have Patricia Staller. Her contact is 906-774-3300, extension 34515. And just a word with the VIST coordinators, they do specialize with the care for the legally blind veterans. If you are a veteran, or if you're referring a veteran and you're not entirely sure if the person is legally blind or not, go ahead and contact the social work or the VIST coordinator at the local VA to you, and they can start to help guide you and get you the right information on if this person's appropriate for VIST, if they do have vision loss, all of the other benefits available. So don't be shy to call any of these people and just ask a general question, and they can always refer you to someone more appropriate if that's the case. So that's what they need to do. And then, of course, the Wisconsin Council of the Blind and Visually Impaired is right in downtown Madison, and our contact number is 1-800-783-5213. And you can call us anytime and ask for any of our staff here to get you more information about services for anybody, and in particular services for veterans. If you have questions going forward about any of this presentation or how to contact these VIST coordinators around the state, please don't hesitate to call me, Amy, at the council, and I can guide you into the right direction. So at this point, we'd like to open this up. We'll leave the slide up here. We'd like to open this up if anyone has any questions or anything that they'd like to share. So Jean just asked, how do you know which VA center to go to? I'm going to turn that over to Kurt, so hold on one second.
Hi, everyone. So in knowing which VA center that you go to, they are located in different sections. The state is broken up. So in general, I can just say that the southwestern part of the state would be the Madison VA. Running from approximately Green Bay all the way down Lake Michigan to Milwaukee is the Milwaukee VA. Toma covers the central part of the state, La Crosse to Wausau approximately. And then Iron Mountain, which is in Michigan, covers the upper peninsula of Michigan and then the northeastern part of Wisconsin. So anything kind of west, northwest of Green Bay. The northwestern part of the state, so anybody who's north of, say, Chippewa Falls area, they're actually covered by the Minneapolis VA. Some people do choose to go to the Toma VA from that area. If you are unsure, again, give one of us a call, one of the VIST coordinators. We can always look at where you live and say your options. So some people do live close to the border of maybe one or the other. The ultimate thing is that it's a veteran's choice where they want to go. So some veterans who live maybe near Fond du Lac or the Beaver Dam area, they can choose really, would they prefer to go to Madison, would they prefer to go to Milwaukee? At that point, it's really their choice. So the next question is, does the vision loss need to be related to service time? And the answer to that is no. Actually, I can speak here. I have about 160 legally blind veterans, and I would say that 10 of them, maybe 15, actually have a service-connected disability related to their vision loss. And that's another great thing Amy talked about is veterans who served in wartime, now they're in their older age, maybe 70s, 80s, go blind due to an age-related disorder like macular degeneration, can come to the VA, get their needs met, and get the care that they need. So it's a really good service that the VA provides. Thank you for your question.
And this is Amy again. I'd just like to follow up just very quickly with what Kurt said about that. It's also the legally blind are the ones that would go down to Hines, and the legally blind are the ones that Kurt and the other VIST coordinators specialize in. But any veteran with a vision disability can get services through the VA. So, and it does not, again, have to be related to service time, and it does not have to be a service-connected injury. So any vision loss can be served by the VA.
I had just a question. I don't know if it's answerable or not, but Amy, you had mentioned that there's no BROS or visor people in Wisconsin. So how do people get that kind of follow-up in Wisconsin? Outpatient. Yeah. Oops.
So the question is, there's no outpatient in-home service like the BROS or the visor in Wisconsin, and that's unfortunately, that's where then we would look at maybe the council coming in to help out or some state services. The VA just hasn't been able to justify getting an outpatient specialist into Wisconsin. If you feel like that's a very big need, you can contact your local VA and just let them know how many people you have that you feel could benefit from that. If they can get enough numbers, they can justify to get a position. I personally feel that Wisconsin should have an outpatient specialist that goes into the homes for the VA. It's incredibly valuable, but those decisions are made higher up than where I am at. So do share that if you do find that something like that would be useful.
So we have a question that says, does the VA pay for assistive devices, looks like, or just services? So the VA does pay for assistive devices. Again, things such as magnifiers. A big one is the closed-circuit TVs or CCTVs. If someone is determined the need for that, and again, that's a big point, if our low-vision optometrist determines that that would be beneficial, then the VA does provide those services. And the next question is, what kind of help did the Hines program offer your wife or family? And this one's for Clarence.
Thank you. There is a very helpful opportunity to have your spouse, if you will. I'm not going to say necessarily wife because we have both men and women in the military. So your spouse can come down while you are at the VA for 3 or 4 days, let's say, prior to the end of your visit. During that 3 to 4 day period, what will happen is your spouse will actually go through the various phases of your education. There will be experiences on walking blindfolded, using a cane, going up and down stairs, walking around corridors, all with the cane. You'll have an experience to go into the various places where they do, for example, lacing of a belt. That was one of the things I had to do, was to actually weave an entire belt, for myself, and that was done blindfolded, where you have 3 fingers that have got to go through 3 different pieces of leather, and eventually it may take 100 of those pieces to be for your belt. These are all experiences which your spouse will learn how you transfer your vision into another sense, if you will. So the person is going to experience what you have experienced, but on a more limited basis. She'll also work, or she or he will actually work on the closed-circuit TV, the computers on the what they call the Zoom Text 10 program. I might say on the closed-circuit TV, they are a very good piece of equipment, but I'm finding that in the closed-circuit TV, there's another piece of equipment that really may well be much better, and I'm hoping that will come into play, which is more of a photographic piece of equipment, a digital piece of equipment, because the ability for clarity and sharpness is much better than it is in the closed-circuit TV. But yet, all those things are made available to your spouse so that when you need help, and I have found that I need it quite often, my spouse is available to help. Hope that will be helpful to you as well.
This is Kurt again. I want to add on that we also have, the Hines VA also has what's called a Fisher House, and that's the equivalent of, let's say, a Ronald McDonald House at a private hospital. That is a place where a spouse or family member can stay, if there's room there, while the veteran is at the Hines Blind Rehab Center. And it's kind of a hotel style of living. There is another question here, and it says, is there a limit amount for the assisted devices if it will increase the quality of life for a veteran? And the answer to that is no. If the devices are deemed, again, appropriate to the veteran's needs and to continue to improve their independence or increase their independence, there is not a limit. Again, one thing we didn't talk about is also computers. So if veterans are interested in receiving a computer, also moving into newer technology, things such as iPhones and iPads, if those are more appropriate for a veteran than a standalone computer, they can get that training as a legally blind veteran down at the Hines Blind Rehab Center. So that is an incredible device that can provide another level of independence with our increased dependence on digital devices. The VIST coordinators at the VAs are the people who complete the application for a veteran to go down to the Hines Blind Rehab Center. So that would be meeting with myself or one of the VIST coordinators and doing about an hour to an hour and a half assessment and determining what a veteran's goals are and their needs are, and then sending out the application from there.
Okay, I don't think there's any other questions. So I'll just do a quick look through the line. It doesn't look like anybody's typing anything, so I think we'll go ahead and wrap it up then. So first, I'd like to thank Kurt, Amy, and Clarence for providing us with such good information and just wonderful experiential information. And thank you for attending today's webinar. We are already planning the next webinar on the value of low vision evaluations and adaptive products from our Sharper Vision store. We do this each fall, and this year's will be on Thursday, November 12th at 1 p.m. So we hope that you will join us. There will be information coming out on our webpage and in our on-site shortly for registering for that